Good morning. I wanted to ask Minister Duclos, is there any news on children's medications, specifically pain and fever medications, in terms of the situation in Canada? Are you planning on bringing any imports into Canada? We're hearing about shortages in the United States now, and of course, there could be a second wave of respiratory virus and respiratory illness this winter.
Thank you for the question. So first, let's acknowledge that the situation has been quite difficult in late 2022 for parents, caregivers, teachers, and obviously for children. No, there was a shortage of children's analgesics, which had all sorts of bad impacts, including the stress that families felt around those shortages. Now, the second thing I would add is that thanks to the hard work of all those that had to be involved, and that included obviously domestic producers, importators, those that are importing those drugs, the hard work of pharmacists, medical associations, and hospital representatives. Now we were able to share a lot of very precious information among those partners so that they could work better together and increase significantly domestic production. Domestic production in some cases has been multiplied by 4 in the last few months. Yes, there have been special importations of additional drugs, and that has made a significant difference. The importations of over 2 million units of analgesic bottles. So thanks to that great work, imports, but also very significantly increased domestic production, we hear and we see that shortages have started to disappear in the last few weeks. Now, it's not perfect everywhere, but the situation is much better now than it used to be. As I mentioned in my remarks earlier, 3.8 million additional bottles towards the end of 2022, additional to what would have normally been the delivery of analgesics bottles, and then another more than 1 million bottles that will be produced domestically by Aeon just in January, in addition to all of the other domestic production that other companies will also be providing to the market in the next weeks and months to come. Finally, we've seen that drug shortages, in this particular case, because of significantly increase in demand, drug shortages can occur quite rapidly. So I've asked my officials to work with other partners to make sure that we can address those issues in the longer term too, if they do arise. So there are important work that is being done with provinces and territories, domestic producers, pharmacists, wholesalers, so that we are better protected in the future if a situation of that sort were to arise again.
I have a different topic for you. We have a statement from Health Canada that says they received proposals by Alberta for the importation of children's ibuprofen and acetaminophen for use in pharmacies, and that a decision was provided to you guys in December. What exactly did that decision say?
There's a couple of things that we had to do in working through with a new supplier. The Health Canada has to go through and examine the manufacturer. They have to examine our import facilities. We had to make sure that the formulation was the same as we would sell for generic products here. We had to get French and English packaging approved. And we went through all of those different steps, and so as a result, we have our first shipment arriving on the weekend. It's going to be for Alberta Health Services use. It's 250,000 bottles. The remaining 4.750 bottles is 4.750 million bottles are going to be subject to an additional delay, because for retail use you have to have a child-proof cap. As I understand it, we are working on making sure that that approval process is taking place, and so that'll be the second batch. And as soon as we know when the retail use is going to be available, we'll do another press release. But the good news is that our Alberta Health Services hospitals will have the first shipment by this weekend.
Well, I'm talking specifically about pharmacies. So those are supposed to be on the shelves by Christmas, is what you guys said. They aren't on the shelves. So I'm just wondering, so how I understand it is that it was actually rejected, that proposal, in December, and then you had to put proposal. Is that correct?
No, it was just a process we went through. I mean, we respect Health Canada has a role in making sure that we have the safest product possible on the shelf. And the issue that they had was that when you make a product available for a retail use, it has to have a child-proof cap. So we're just working with the manufacturer to make sure that that is in place so that we can make it available for retail use. And look, I don't want to rush Health Canada. Certainly want to make sure that people, as soon as the supply arrives, that they feel confident in it. It really was just a matter of us meeting the regulatory conditions, and that was the last condition we needed to meet.
So you had to put forward a new application.
We've been working with them right from the beginning. We always knew that we would have a certain amount that would arrive that would be for AHS use, and then we had to continue working with them to make sure that we had the bottling that met their specifications. One of the specifications was we had to make sure that it was listed in the same familiar type of formulation that we have in Canada. We had to make sure French and English labeling, and this last hurdle is we just have to make sure we've got the child-proof cap. So it's been a process that we've been going on. It's just taken a little bit longer than we expected, but the first shipment is arriving this weekend for Alberta Health Services.
Just to confirm, this is the same application that came back in December.
I've been working with this on this all the way along. We have been working with Alberta Health, Health Canada to make sure that we were meeting all of their compliance. It's a brand new supplier. There's just a couple of hurdles that we needed to get through, and we're almost on the last one.